The prevention and control of infection, a responsibility we all share, a planetary problem, and from now on, the focus of a World Congress. From the 29th of June to the 2nd of July 2011, over 1,200 experts from 86 different countries met in Geneva for the first international conference on prevention and infection control. The conference had two objectives. First, to take the topic of infection prevention and control outside the hospital context and to broaden the implementation of its principles across all types of healthcare facilities. And second, to mobilize not only healthcare professionals and patients, but also policymakers in the ongoing and effective battle against the resistance of infections to antibiotics.
We decided somewhere in the middle of last year in 2010 that we should have this new conference because there's truly a need for a fully international, global meeting of all people in infection control that is really aiming not only at the best research but also the best practices. And none of the existing meetings really had that. They're either not fully international or they're only at research or at practices, so we believe that we had a niche to go into.
It was logical that Geneva should host this first conference. Thanks to its university hospitals, Geneva plays a leading role worldwide in hand hygiene practices. The Geneva University Hospitals, very much at the cutting edge in matters of public health, acts also as the WHO collaborating centre for the prevention of nosocomial infections.
On peut dire Genève est une sorte de capitale de la santé. Et puis, moi-même, je suis très intéressée, puisque en charge des affaires étrangères, de la coopération au développement. Et la coopération au développement suisse a mis, elle aussi, l'accent sur le renforcement des systèmes de santé, l'amélioration de la qualité des soins, et donc sur la prévention des infections.
Prevention of infection and antimicrobial resistance is also a matter of discipline and proper practices. In order to initiate and in some cases to impose new hand hygiene practices, the Geneva University Hospitals and the WHO have adopted a simple approach using the 5 moments as a recall of the 5 fingers of a hand.
The 5 moments, the first one is in terms of before we touch a patient, we should be cleaning our hands because we are going to him. And the second moment is in terms of before doing a sterile procedure, we definitely have to clean our hands. And the third one is, in terms of after we've seen a patient, because we may have picked up some organism before going on to the next patient, we will need to clean our hands. And the fourth moment is after we are touching body fluids, and we will definitely have to clean off our hands before we go on to the next patient. And the last but not least, because the patient is in the environment and he is shedding organisms, it's contaminated. So if we are touching any part of the environment, we definitely have to clean our hands.
Hygiene and prevention are also subjects serving to highlight the degree to which the North and the South are indeed poles apart. This first international conference has already given everyone a chance to express their views and at the same time an opportunity to listen to the concerns and to hear about the initiatives taken by other countries.
This is very impressive to see that, we can learn from each other whoever we are and wherever we work. This actually is very close to our mission. The mission that we have for this program that we are leading for the World Health Organization called African Partnerships for Patient Safety, where we have to pair hospitals, let's say in the north, in France, in the UK, in Switzerland, and hospitals in Africa, with the mandate to have one patient safety excellence center in every country in Africa for 2015. And this is really our mission, and we hope to do it as best as we can.
L'investissement de l'université et des hôpitaux universitaires genevois, c'est quelque chose qui me tient vraiment à cœur, parce que c'est aussi là, par ces contacts directs, qu'on peut faire avancer les choses et par l'expérience qu'on acquiert aussi lors de ces contacts directs.
Today, infection and resistance to antibiotics are media daily concerns. Between the available evidence and questions remaining, specialists in the field all agree that prevention is critical. Such a commitment to prevention will lead to the implementation of new measures and research programs.
It was part of the meeting. The meeting is infection prevention, preventing the cross-transfer of antimicrobial resistance. Antimicrobial resistance is a critical phenomenon. It is a universal phenomenon. Last year was the New Delhi beta-lactamase new bacteria that actually originated from India and then spread in particular in Pakistan and in the UK and in the rest of the world. This is a multi-resistant bacteria. There are a lot of concerns around, and we had several conferences and lectures on the topic. Now, of course, we were also right on the top of the actuality regarding E. coli. This E. coli that is spreading in Germany. We are by chance certainly at the end of the epidemic, at the end of the outbreak, but certainly we are privileged to have one of our best friends coming who was investigating the outbreak, giving us the last news, the last hypotheses. You know, we don't know everything about the topic right now, but we know most of it, and it was absolutely unique to have these people around us. I guess the participants really appreciate.